Do you have to sign up for Medicare if you are turning 65, you're still working, and you have group coverage? I talked to two different people today, both who are turning 65, both who have group coverage, and the answer I gave them is different. One of them needs to sign up for Medicare, the other does not. So what is going on here? Click here to learn more. Let's discuss. There was one important factual difference between the two calls. The first person works at a company where there are 20 or more employees. That person, he does not have to sign up for Medicare. The second person worked at a company with 19 or less employees. She needs to sign up for Medicare. So I'm going to try to break this down so that you can understand why. Neither person, if they delayed Medicare, would have a penalty when they signed up later. They would both have what's called a special enrollment period, but the person who works at a company with 19 or less employees is not going to have full coverage. In other words, they're only going to have a secondary payer, and that is not a position you want to be in. So I'm going to explain to you the difference here. If you take a look at the document behind me, it is an excerpt from Medicare.gov, and I'm going to read the part that I want you to focus in on. So it says right here, if the employer has less than 20 employees, so it's 19 or less, and isn't part of a multi-employer or multiple employer group health plan, then Medicare pays first and the group health plan pays second. If you look higher up here, it says if the employer has 20 or more employees, then the group health care pays first and Medicare pays second. So what am I even talking about? Let's look at another page so I can hopefully help make this clear as to why the person with 19 or less employees needs to get Medicare and the other person can decide if they also want Medicare, the one with the 20 or more employees. Let's take a look at this language behind me. What does it mean to pay primary/secondary? The insurance that pays first, primary, pays up to the limits of its coverage. The one that pays second, secondary, only pays if there are costs that the primary insurer doesn't cover. So if you remember what I just showed you a minute ago, how Medicare and group healthcare coordinates, the company with 19 or less employees is secondary to Medicare. So if you don't sign up for Medicare and you decide to keep your group plan, you do not have primary coverage. So it's very possible that if you end up with a very expensive claim and your existing group plan recognizes that you were eligible for Medicare, you may not get that coverage. They may not cover your claim for you because you should have had Medicare in there as the primary payer. Now, the person with the company with 20 or more employees, it's primary to Medicare. So you could keep that plan and get Medicare Part A. If you wanted to. You wouldn't necessarily get B because then you're paying double premium. But the point is that in that scenario, when you have a claim, it is the job of your group health plan to process it and pay most of the bill. Whereas in scenario number 2, 19 or less employees, if you don't have Medicare, you don't have anyone that has that job, and that could be problematic. Now, it's not to say that somebody hasn't ever found themselves in that scenario, 19 or less, and they didn't understand they should have signed up for Medicare, and they might have had claims covered. But if they had had a very big claim, that insurance company would probably be more drawn into the fact that, oh, you should have been on Medicare and it's not our job to pay. So if you're at a company with 19 or less employees, unless they put it in writing that they will continue as your primary payer, you need to sign up for Medicare.